More than 1 year after the fall of Bashar al-Assad in Syria, the country is still grappling with a host of challenges. Sectarian violence in particular has caused deaths and significant displacement, aggravating an already fragile humanitarian situation. Well, we're going to talk more about this with today's perspective guest. Mohamed Alaa Ahmado joins me now from Idlib in Syria's northwest, where he works for Mehad NGO. You're working as a doctor there then in Idlib. Give us an overview of the humanitarian situation in Syria and what you've been seeing there on the ground.
Thank you and good morning for having me in this important program for discuss this issue. And if you allow me just to start with a brief introduction about our organization. We have been operating in Syria since 2011, and we have our work focus on health system recovery and the delivery of essential humanitarian health services. And let me explain, as you said, that the current situation now based on our work on the ground and the reports from the OCHA and UN agency. Now, and the situation in Aleppo has relatively stabilized in recent days following the ceasefire announced on January 11. And as you may know, the active fighting has significant decrease, and there is a fragile calm now across the city. But on the other hand, this doesn't mean the crisis is over. While some families have started to return to their neighborhoods, many people are still displaced, and humanitarian needs remain high. For example, and in some areas, return are delayed due to poor services, security concern, and unexploded orders. If we speak more about the health services, and as you said, the health services were affected during the escalation. But now the access has gradually improved following the ceasefire. But now at the same time, the surface remain under high pressure due to the displacement of health staff and people, and increased demand and partial damage or disruption to some facilities.
And what kinds of numbers, if I may ask, what kinds of numbers of displaced people are we seeing, and where are they coming from? Where are they going to? You mentioned the clashes in Aleppo. Are there any other flashpoints where people are fleeing? According to the reports, the recent escalation caused a large-scale displacement in a very short term period of time. And according to the latest assessment from OCHA, around 119,000 people remain displaced, while approximately 30,000 people have returned to their homes since the ceasefire. And for the locations, the majority were displaced to rural Aleppo, especially in Afrin and its surrounding area, and where it's about 90% are staying with host families, and only a small proportion are staying in collective shelter or temporary sites. And so what are the living conditions like for these people then, either, in these shelters? Do they have access to clean water, food, medical supplies?
Thank you for your question. I think we need to speak more about the needs. And let me start with health, as this is our core area of work, and while recognizing that needs across all sectors remain urgent. If we speak about health services remain under pressure, and there is a clear need to strengthen primary health care services and ensure the provision of essential medicine kits to hospital and primary health care centers, and rehabilitate health facilities that were damaged or disrupted during the escalation.
Also, mobile clinic service it's also remain essential to reach displaced and hard to access population. In addition to that, and if we speak about the psychological support and awareness of explosive hazard, it's also vital, especially for children and families. Alongside health, the cash assistance remain critical, and as family needs, support to cover rent, foods, heating, medicines, transportation. There are now in the winter season, and and also there is a huge need for the food and non-food items, including blanket, winter clothes, and hygiene supplies.
And
Yeah,
how is your work with Mehad trying to solve these kinds of problems? Do you have enough to meet these needs? Is more international aid needed?
Yeah, from our side in Mehad, as a part of the health sector response, we work alongside other humanitarian organizations, UN agency, and local health directorate. And we also contribute to need assessment to identify priorities on the ground. And based on the identified need, we respond by providing a batch of essential medical consumables to health facilities and hospital through the coordinated health response mechanism. At the same time, we are now in the final steps of launching 2 mobile clinics in rural Afrin to provide basic medical services to displaced population there. In parallel of that, and in coordination with our headquarters in Paris, we are also engaging with some of our donors to expand our response and scale up our activity in line with the needs.
And for you, what do you see as then the main challenges going forward, and particularly for Syria's new government?
Yeah, if we speak more about the humanitarian response, we from our side in Mehad, we faced challenges similar to the other humanitarian actors, including the reduced humanitarian funding for Syria overall. And if we speak specifically during the escalation, the field operation in Aleppo became very challenging, and many of our field and administrative staff were displaced, including members of our mobile clinics team. And here, I think I would like to share something that we consider both as a challenge and a success story. It's many of our mobile clinic and warehouse staff were themselves affected by this conflict, and displaced from their home. Despite this, they show strong commitment and choose voluntarily to continue providing services in the area where they were newly displaced, even under difficult conditions.
It's very important work indeed.
Yeah.
Unfortunately, we have to leave it there. We've run out of time. Mohamed Alaa Ahmado from Mehad, you're doing very important work. Thank you in Syria.
Thank you.